So when you were flossing, what you want to do is open real wide and then go in between, in the middle right here, go in between the teeth and then hug one side of the tooth and be able to go like that.
Any questions that are popping up in your mind, comments down below.
The reason why you brush your teeth is you're trying to take away the plaque. You're trying to take away the plaque that builds up on your teeth on a regular daily basis. And also you want to be able to go ahead and brush off any food debris that's in there. So some people, when they're eating, food gets stuck in between their teeth, and then there's times when you cannot remove them just by brushing. So one of the things that you have to do is be able to get in between your teeth, and one of the instruments that we use is by flossing it. So what you would do is be able to go get one of these dental floss and use this at least once a day. So when you were flossing, what you want to do is open real wide and then go in between, in the middle right here, go in between the teeth and then hug one side of the tooth and be able to go like that. Hug one side of the tooth and then the other side of the tooth. But as you hug the side of the teeth that you're working in, you want to go up and down, and then the other side, go like that. And then you could go ahead and pull that out. Now sometimes this is really hard to pull out. Then you'd have to go ahead and take it out and then pull the floss out. The challenge of this is that if you're either having braces or if you have a bridge, you cannot take the floss out a certain way. When you're flossing braces, it's hard to put the floss in because of the wire right here is going to prevent you from going all the way down next to the gum. But the way that you do that is you use a floss threader, just like if you were doing sewing, and then you go like that. So the way that the floss threader works is that this will have to be floss thread through the teeth like this. Okay, so that it goes into the teeth just like that. And then so when you go and thread this, it threads right through. And so now, see, one thing about having braces is that you can't pull this out because the wire is there. So you have to be able to go ahead and brush this way. Very hard to do because that means that you're going to have to go ahead and go right through all these braces to be able to floss. Now, one of the instruments that we use, instead of doing something like this, would be an interproximal brush like this. Now, you would not use this here because this is too big. We're going to use a interproximal brush. Now, we'll be able to brush in between like this. See how that looks there? Here. And then you could go in between the teeth with this also. Now, it's harder to go in the back, but most of these are going to be towards the front of the teeth where the braces are. You got an interproximal brush like this. Or like I was saying, you could use the floss or the floss threader that we had, which is one of these floss threaders, just like that. The other challenge that people have when they are flossing is when somebody has a bridge like this. So people, when they're missing teeth and they've got a bridge like that, and then you cannot put the floss. So when somebody has a bridge, you cannot put the floss in between the bridge because the bridge is connected. So when a bridge is connected, this will not go through. This will not go through the bridge this way. When the bridge is in the mouth, the floss can't get in between these. So that's when you want to make sure. Then when you have a bridge like this, this is when you have to use the floss threader again, and then be able to go in between the bridge this way. Okay, and then take this out and then go right underneath the bridge. Okay, and then floss right through. So that is the technique that we're showing our patients when we give them direction on how to floss their teeth. Be sure to subscribe and make sure you tap right here for our next video.